Euthanization is the deliberate action of taking one's life to relieve unstoppable suffering. There are two main classifications of euthanasia.
Voluntary euthanasia is conducted with the patient's consent. This occurs in cases such as terminal illnesses like untreatable cancers. Involuntary euthanasia is conducted without the patient's consent. The decision is made by another person, usually a family member. This type of euthanasia is used when patients are in unresponsive conditions, such as being brain dead or permanently comatose.
There are two procedural classifications of euthanasia.
Passive euthanasia is the withdrawal of life-sustaining treatments. Drugs and machinery used to keep the patient alive, such as breathing assistance and life support, are shut off. Active euthanasia occurs when lethal substances or force are used to end a person's life. Lethal doses of harmful drugs, such as heavy painkillers like morphine, are injected into the patient to manually shut down the body, or a forceful deadly action such as suffocation is used. This type of euthanasia is the most controversial. So, should we allow euthanization to happen?
Should it be universally legalized?
Is an individual's human right to decide whether they want to live or die, especially if they're in constant pain.
But if that physician breaks physician-patient trust and goes against his patient's wills, he could get arrested for a lawsuit.
Well, doctors shouldn't have the power to keep a patient alive if they choose to pass.
But should they have the power to end someone's life?
Not to mention the emotional and psychological damage done to not only the physician, but the patient's family as well.
Yeah, and medical bills can become very costly.
The average medical costs for a person with glioblastoma is around $117,000, with only a 17% survival rate.
If someone is suffering and can be put out of their misery, why continue to pay hundreds of thousands of dollars to keep them alive?
In that case, if euthanasia is considered an option, then why would doctors even try to save a patient?
Actually, there are guidelines and regulations for carrying out euthanization. This not only protects the physician, but ensures that the patient is 100% sure of what they're doing.
Yeah, there are laws and acts in place in Belgium, the Netherlands, Australia, and the U.S. states of Washington and Oregon that legalize euthanization. Acts like the Rights of the Terminally Ill Act and the Death with Dignity Act.
So, is euthanasia wrong?
Euthanasia should be considered justified so long as there is proper consent from the patient or family member.
It should be allowed to be conducted legally, keeping in mind regulations that protect the patient and the physician.
That being said, euthanasia should never be someone's first choice. There are many organizations that help deal with pain that should be considered before euthanization. Some examples include the Academy of Integrative Pain Management and palliative care, which is specialized medical care for those with serious illnesses and pain.